Shelley Viger, and I was diagnosed with breast cancer just before Christmas.
I'm Kathy Stevens. I was diagnosed with breast cancer at the end of January.
Okay, so I can imagine the emotions and feelings, but, talk about the feeling, when you found out you were diagnosed, and then when you talked to Ian and Edie about, the heart problems that follow.
It was shocking, of course, and overwhelming. It was a lot to deal with, and then coming in and talking to Edie and Dr. Paterson to go over the research, it was very, I don't know, what would you say? Overwhelming? Again? A lot of information.
It definitely was, but when you're diagnosed with something like breast cancer, having an extra team in your corner, I guess, has been a great thing for us.
Yeah.
And how has it been going so far?
It's been going really well. I think the added support of Edie during our first, between our first chemo and second chemo has been huge. Having the added blood tests and the MRIs and everything to know that our hearts are fine as of right now. And
definitely.
Okay, and how important is it, the work that these guys are doing, at the University of Alberta?
It's been fantastic for, I think, both of us. The research that's been done in the past, we are beneficiaries of. Our prognosis wouldn't be as good as it is today without that research. So I think I can speak for you too.
Yeah.
Anything that we can do to help further that cause, I guess, is a good thing.
Mm-hmm.
Okay, thank you very much to both of you.
You're welcome.
Hi, Ian Paterson from Division of Cardiology, University of Alberta.
I'm Edith Pituskin. I'm a PhD candidate in the Faculty of Rehabilitation Medicine.
Okay, so first of all, tell us why we're here today. Talk about the MANTICORE clinical trials.
Well, this is a really important study that we've decided to undertake with our friends at the Cross. We want to try to see if by giving a commonly used heart failure treatment, if we can prevent some of the heart injury that occurs with some of these women with breast cancer getting a type of chemotherapy called Herceptin.
Okay, why did you decide to do this and talk about the importance?
Well, I mean, I work in heart failure. That's one of the areas of medicine that I work in, and we started seeing some of these women come to our clinic who were unfortunate enough to develop heart failure, and we said, we have effective treatments to treat this. Maybe if we gave these pills sooner, we could prevent this from ever occurring to them. And so we've spoken with our colleagues at the Cross, and they also said, yeah, this is a great idea. And luckily, we've been able to get some funding from Alberta Cancer Foundation as well as this Canadian Institute of Health Research. So there are granting agencies in Alberta as well as Canada that also feel this is an important study. So it's nice that we've been getting some recognition from granting agencies across the country.
Okay, and Edie, how have things been going so far? You've been working a lot with the patients.
Things are going really well. I think that everyone who hears about the study understands that it is an important aspect in terms of not only preventing heart damage, but long-term survivorship. I mean, we're giving the chemotherapy treatments, including Herceptin, for the aim of preventing breast cancer from ever coming back. But on the other hand, we also need to make sure that people's hearts and the rest of their bodies stay in good enough shape to receive the treatments, as well as to avoid any long-term damage to the heart, vasculature, and other muscles. So everyone who's heard about the study is quite excited about the possibility of taking part. Certainly not everyone is able to, given other circumstances or eligibility, but things have been going well.
Okay, thank you both very much.
Sure.